Welcome to the class of maternity nursing in the topic of labor and birth with me, Nurse Kinan. This material is prepared by Nurse Eva Berti, PhD. We remember in the Bible, especially in Genesis 3, verse 16a, it said that I will increase your pain when you give birth. This verse is our guide to help mothers when they are giving birth because labor will then give them pain, so we can provide comfort during the process of labor and birth. The learning outcomes for today's class is to learn about the types of labor and birth, to learn the factors affecting labor and birth, to learn the process of labor and birth, to learn the pain during the labor and birth. The theories of labor onset is actually a combination of factors from the mothers and the fetus in influences labor. From the mother, the uterine muscles will do stretching, which will resulting in prostaglandin release. Then there will be pressures as well on the cervix, which will stimulating the neutral release of oxytocin. Oxytocin will stimulate, then work together with prostaglandin to initiate the contraction. So then the labor will begin and there will be constant contractions during labor. There will be changes in the ratio of estrogen and proestrogen, which will stimulate the uterine contractions. The placental age, as the placenta is going to be at week 36, 37 until 42, this also will trigger the contraction. There will be a rising in the fetal cortisol level, which will reduce the progesterone formations and increase the prostaglandin, where the contractions will be triggered. The fetal membrane also will produce prostaglandin, and this will increase the stimulations of contraction. And there will be seasonal and time influences where will the mother uh, process through the labor. Now we are going to learn about the types of labor and birth. There are types of labors according to how the labor is happening. We know that the labor can happen spontaneously, and we call this as a vaginal birth. So the mother will then start to have the contractions during week 36 to 42, and then the mother will then deliver the baby vaginally. If this does not happen, then we can help the mother through the inductions, where we give the medications to induce the contractions, and the mother then will be able to deliver the baby. If these inductions and spontaneous birth is not happening, then we will be doing the obstetric procedures, where we can also have an operative vaginal birth. So we will do forceps delivery as well as episiotomy to assist in the delivery of the baby through vaginal birth. If these procedures didn't work as well to the mother, then we will suggest what we call as C-sections or cesarean sections, where the mother will go through the delivery in the operating theater to get the baby out. There are also types of labor and birth according to the gestations. We know that if the baby be born below 18 weeks, we call this one is abortus. If the baby is born between 22 to 28 weeks, we call this immature. If the baby is born between 28 to 36 weeks, we call that baby as premature baby. And if the baby is coming out on the 37 to 42 weeks, so we call this as mature baby. And if the baby is coming more than 42 weeks, we call this is a postmatrus baby. So these are the types of labor and birth according to the types on how the baby is coming out and according to the months or the weeks of gestation. There are four factors that affecting labors and birth. We know it as 4P. We have the passageway, or this is the way the vaginal, the cervix as the way to come out. Then we know the passenger, or this is like the baby, the one that we are pushing out to be delivered. And then the power, so this is related to the contractions of the mother during the process of delivery. And the psyche, or this is how the mother is really prepared to face the labor and birth. Let us know more about the 4P, or the factors affecting labor and birth. So the passageway will refer to the birth canal, including the pelvic, the cervix, and vagina. So the shape, size, and the flexibility of the passageway are very crucial in determining the process of labor. When the mother entered the trimester 3, we ask the mother to do a pregnancy yoga to help the mother inside their labor and birth process. We also ask the mother to do some massage to the vagina to increase the flexibility of the vagina during the process of labor. The passengers refer to the baby and its positions inside the womb. The size of the baby, the presentations, positions, and the stations of the baby will all influence the progress of labor. If the baby is big, if the baby is in a bridge position, transverse positions, or cephalic position, this will also improve and influence the progress of labor. If the baby is not positioned in the correct autonomical position, then this will also cause difficulties within the process of labor. Next one is the power. So the power is actually the forces or the strength that the mother need to give birth. There are two main powers. The first one is the uterine contractions, and the next one is the maternal pushing efforts. The uterine contractions is the involuntarily tightening of the uterine muscles, which will help to thin and open the cervix so the baby will be able to descend through the birth canal. In this position, we will understand that the mother will have increasing pain during the process of labor and birth, and as a nurse, we need to give the comfort. So we provide comfort measures for the mother during the process of labor and birth, so the mother will have lesser pain during labor and birth. The psyche is actually referring to the emotional and psychological well-being of the mother during labor. How well is the mother's mental stage? The level of relaxations, confidence, and support can play a very significant role in the progressions of labor. So in the Trimester 3, we encourage mother to attend childbirth classes where the mother will be prepared through their emotional and psychological, as well as the mother will learn how to do the pushing and the breathing during the labor. And this hopefully will prepare mom to have a good psyche during the labor and birth. Now we move on to the labor and birth. A normal delivery is the series of cervical dilatations to birth the baby, then birth the placenta from the uterus vaginally. You can read on the guidance by WHO so we can understand how it is the intranatal childbirth with positive experience. So the baby, once it's coming to the passageway, will do the head floating before the engagement. The engagement will do the flexions and then descent, and then having further descents with internal rotations, and then complete rotations, then begin the extension, and then having the complete extension, and then restitution with the external rotation, and then um, we'll have the shoulder coming out, and then we'll have the delivery of the posterior shoulder. So there will be delivery of the anterior shoulder first, and then followed by the delivery of the posterior shoulder. We move on to the stages of labor. There are 4 stages in labor. The first is about the dilations. We know the LAT, or the latent, active, and transition phase. This happen according to the theory around 11 to 12 hours, or can also be until 24 hours in the first pregnancy or pregnancy. So the latent phase is the opening of the dilations of the cervix 1 to 3 centimeters. Um, it happens every 2 hours. And then the active phase, the opening 4 to 8 centimeters, it happens every an hour. And then the transition from 9 to 10 centimeters happens every 30 minutes. After fully dilatations, and then the mother will turn to the second phase, where the baby will be born with the 7 cardinal movement. And then we move to the third phase, where then the placenta will be born, and then we will see that the Schultz is the shiny fetal membrane that have the baby, and then we will have the Duncan, which is the dirty maternal surface that is the one that connected to the mother uterus. And after the placenta is being born, we enter to the 4th stage, where we wait 1 to 2 hours after birth to observe the blood loss of the mother. Then the normal blood loss after delivery will be around 300 to 500 milliliters. Here we also observe how is the mother with the baby, the bonding, the process of immediate attachment, and then also the breastfeeding to the mother, from the baby, how the mother and the baby are doing the initiate breastfeeding during this time. What are the signs of labor? So the mother will have the initial complaints of painful contractions. There will be a vaginal bleeding, or what we call the bloody show, and there will be fluid leakage from the vagina. So we have to ensure that this is the rupture of the membrane, so the placenta is ruptured, and then we need to check the testing of the pH to see if the fluid is really amniotic fluid. And amniotic fluid has the pH of 7 to 75, which is more basic than the normal vaginal pH. So when this happens, then we will know that the labor is then begin. So during the labor and birth, the mother will have pain. It is because the estrogen will be released from ovaries, which will then induce oxytocin receptors on the uterus to have the contraction. There will be also oxytocin that is released by the posterior pituitaries of the fetal on the mother, which will then stimulate the uterus to contract. At the same time, this also will stimulate the placenta to make more prostaglandin, where then will stimulate more contractions to the uterus. These stimulations always stimulates the placenta to make more prostaglandin, then give positive feedback to the oxytocin to come then release again, so that the contractions of the uterus will be increases, and the mother will be able to push the baby out of the cervix through the vagina, and the baby will be born. During this time, we will learn about the pain during the labor. So there will be discomfort In dilatations in the latent phase from 1 to 3 centimeters, where the contraction will be irregular, it will disappear during ambulations and in sleep, and there was no increase in duration, frequency, or the intensity of the contraction. And do not have a cervical dilations at this time because it's very small, 1 to 3 centimeter. During the active acceleration phase, the dilation will be very painful. There will be opening of the cervix from 4 to 10 centimeters, where the contractions are regular and increasingly strong in the intensity. So we need to make the mother understand that the frequency will be often, the intensity will be very strong, and then durations between one contractions to the other contractions will be very intense or very increasing. So then the mother will understand that it is the time to deliver the baby. Well, these contractions, this strong painful contraction will coincide with the cervical dilation, so we will understand that it's the baby coming out to do the process of labor and birth. During this time, we need to provide comfort measures. We'll learn about comfort measures in the next topic of these classes. Thank you so much for listening. I hope you learned a lot from this session.